Hey, it's Dr. Troy here, the Vancouver Chiropractor. Ginger from Vancouver had a great question for me. She asked me, hey, if I have a herniated disc in my neck or my low back, is there a way to get rid of that without surgery? And the answer is yes. In many cases, many successful cases of patients seeking chiropractic care prior to surgery, I'd always recommend chiropractic before surgery. Let me just explain something. So people always just focus on the disc. That's very myopic, because if you look at a joint, you look at the spine, there's a bone, there's a disc, there's two bones. And so if we look, you've got two bones here, you have a disc, you have nerve roots that come off, and nobody ever talks about the surrounding soft tissue. What about the muscles? What about the ligaments? What about the tendons? So usually we're going to see disc issues associated with spinal misalignment, which is usually caused from big traumas, car accidents, where you get whipped around or falls, or these micro traumas where you do these repetitive small things over and over throughout the day. And I always use the example of a cashier or somebody lifting luggage at the airport. I have a bunch of patients who throw luggage at the airport. They have chronic repetitive injuries. So now what will happen is the spine will shift. And see, if you look at the bones, they're out of alignment here. They've shifted in a different direction. I always ask patients, I go, which way did the disc go? It went that way. And so how do you correct that? Well, you get it to go this way. And so there's a lot of various natural techniques in chiropractic. One of them is adjusting the spine. You can do instrument work. We have a traction unit that can traction the joints apart to help bring nutrients into the disc because they don't have a direct blood supply. So motion's the only thing that's going to heal that joint. Same thing in the low back. If people have neurological issues, I've seen people with foot drop, with numbness, tingling, even digestive discomfort, get clear, completely clear from any of the symptoms, get their function back by specific chiropractic techniques that help them resolve these things. So I always recommend patients have chiropractic care prior to surgery. I mean, it could take 8 weeks, it could take 12 weeks, it could take many months to resolve discal, neurological, spinal issues, depending on how severe it is, how much trauma has been there, if it's degenerating, if people change their lifestyle. I had a guy recently came to me, his numbness in his hands was gone. He said, oh, I have a disc issue. His numbness cleared out in about 5 weeks. And I said, hold on a minute. What have you changed in your lifestyle besides getting adjusted to resolve these issues? Nothing. So I always caution people, you know, maintenance care is also important too. Once things get stable, we encourage people, hey, you should maintain it. Could be once a month, could be once a week. It just depends on the lifestyle, on how much care your spine's going to need to keep it functioning to the max throughout your lifetime. So this is Dr. Troy. If you're interested in checking us out, we do a free consultation, health evaluation to determine if chiropractic's right for you. You can call our office, 360-260-6903.